As you know, atrial fibrillation is the most common cardiac arrhythmia, responsible for strokes, impairing the quality of life, and consuming a lot of healthcare dollars. Fortunately, we've seen dramatic evolution in improvement in approaches to treatment of atrial fibrillation. And over the last several years, we've seen the advent of pulsed field ablation, generally considered an energy source that does not lead to a thermal injury. So we're no longer freezing or burning the tissue in the heart. We're managing to kill the tissue that's responsible for this arrhythmia much safer, in a much safer way, in a much more efficient way, a much more durable way. So one thing that we see across all of these technologies is that patients do much better, the procedures are much quicker, the risk of the procedures is much lower, and the likelihood of patients staying in normal rhythm is much higher after they're done with the procedure, making a huge difference to the way they do it. Our center, we perform about 1,000 AF ablations a year, and over the last year, about 20% of those ablations had been done with pulsed field ablation across several different technologies, and we look forward to increasing that number and potentially adding other procedures such as left atrial appendigeal device closure at the same time as pulsed field ablation. We've done it for a long time with RF ablation, but technology now allows us to do it together with pulsed field ablation. Imagine if you could have your atrial fibrillation ablated and left atrial appendage closed all within about an hour in one procedure and go home the same day. Today, Heart Rhythm Society came out with a statement on the fact that same-day discharge is safe and effective for most electrophysiology procedures. We've looked at our data historically, presented and published our results, and we found that when the patients are triaged properly, sending them home the same day is perfectly safe. They get to sleep in their own bed, and it saves a lot of healthcare resources. And so the combination of new technologies, new approaches, what we're able to do, I think, is making a real difference in the world and a real difference to our patients. One thing that we've done recently that may be a bit more, I would say pioneering, in our field, is we've opened up a new referral stream for patients who don't have a doctor, have a doctor but have not been referred for a formal assessment for atrial fibrillation, for patients who wonder if they're suffering from the condition, who have symptoms such as palpitations, dizziness, other symptoms that could relate to atrial fibrillation, who have family history of atrial fibrillation. We open a pathway where they can refer themselves directly to our center. We've also partnered with a couple of really innovative AI companies. We are working with a company called US2AI, where we can have fully automated analysis of echocardiographic imaging performed at our clinics. We have partnered with a company called Myant. Myant is a pioneering developer of what they call a textile computing platform, essentially fully textile-based continuous wearables that monitor a 3-lead ECG along with multiple other biometrics, O2 sat, blood pressure, temperature, activity levels, etc. And most recently, we've been working with a company called Scienza Health that developed unique AI technology that uses voice analysis to perform a full neurocognitive analysis as well as mental health analysis on the patient. By putting all of this together with a team that includes nurses, nurse practitioners, other physicians, we're able to offer a full range of services to these patients, expediting and improving their care, and I'm really hoping improving their outcomes, as well as helping the society by significantly reducing the cost attributable to this condition at large.
You brought up so many good points about, one, pulsed field ablation has transformed how you guys do AFib ablations, and it's made it much safer, and we've learned that early recognition and referral is super important in these patients. And I know that you've done a lot of work in creating registries and also this concept of a center of excellence. Can you comment a little bit about that?
For sure, and in fact, I published a post on LinkedIn today where I quoted the paper that just came out yesterday. Heart Rhythm just came out with another statement on the attributes of a heart rhythm center of excellence, particularly with respect to AF ablation. And at our center, we have looked at efficiencies and standardization of every process. All the referrals for AF ablation come to a triage office. Every single referral is looked at by the entire electrophysiology team. More complicated patients are booked into clinic to see an electrophysiologist. Other patients, young patients, they're otherwise healthy, they have paroxysmal atrial fibrillation, there's nothing else wrong with them. We don't make them wait to see one of us. They have pre-assessment with one of our nurse practitioners, and if they agree, they get and if it's appropriate, obviously, they get triaged to have an ablation, completely bypassing the whole, waiting to see a physician in the clinic stage. We have developed a website. It's called afibclinic.ca. afibclinic.ca. Using that microsite, we've accumulated a number of resources, including videos, a pamphlet, various forms for our patients to see before they ever see a doctor or a nurse practitioner or have an ablation. And we go over medical therapy, including anticoagulation, rate control, rhythm control. We go over ablation with the patients using those resources. So all of our patients come in fully informed about what to expect from their treatment. Treatment itself, very standardized. We perform these as same-day procedures. The patients come in, get admitted, they have the procedure. Most of these procedures these days take about an hour or so from the patient perspective. We do our procedures on a general anesthetic to make sure that the patients are comfortable. Obviously makes it a bit easier on us as well. Typically we would perform about 5 procedures a day, and the patients all recover in the same room where they came to, and typically go home later the same day. All of these patients get contacted by a dedicated nurse a week after the ablation to check up on them, and all of them go home with instructions. What to do if they have, symptoms X, Y, Z. They're instructed not to lift anything heavy or strain for a few days. They're instructed to get a cardioversion if they happen to have more arrhythmia in the first little while after ablation. They have a letter they can take to an emergency room and show the doctor in the emergency room if they were to present. And then they have full access to this nurse for the first 3 months after ablation. And then 3 months, 6 months, and 12 months, all the patients are seen by a nurse practitioner in a dedicated clinic. The nurse practitioners are highly trained to specifically look after these patients. And they all get a 2-week monitor using the Myant textile platform, which is super convenient from the patient perspective. We're working on another platform that we offer our patients. You can see it at my-view.ca. We know that patients with atrial fibrillation doesn't happen in isolation most of the time. We know that unfortunately a lot of these patients have comorbid conditions. They may have diabetes, high blood pressure, they may overuse alcohol, caffeine, a lot of them are underhydrated, a lot of them are unfortunately overweight. And so in parallel with kind of a clear dedicated atrial fibrillation stream, we have a cardiac prevention clinic, which is also run by nurse practitioners. And in the cardiac prevention clinic, a nurse practitioner is trained to help optimize lipid-lowering medications, blood pressure. Patients who are overweight can be helped with GLP-1 agonist type weight loss program, which is monitored with regular visits through the program. And then myview.ca adds a whole other coaching, lifestyle coaching angle to it. We know that many of these patients eat junk food. They don't know how to cook. They don't know what to eat. They don't know how to exercise. There's a barrier where they just won't start exercising on their own. And so we have a team of exercise physiologists, dietitians, health coaches, and mindfulness coaches who work with these patients, kind of addressing all of these other targets that are not conventionally medical. And what we've done for our AFib patients is we've built a program called AFib Live, which is a 2 months weekly group program, which kind of works also as a patient support program in a way, because they get to interact with other patients having the same condition, and they have a standard curriculum. They have access to a platform where they check in with their coaches. They upload data from their wearable devices, their weight, et cetera, and other metrics. And they have access, if they choose to, they also have access to one-on-one coaching with specific specialists. Somebody may need more mindfulness, somebody else may need more help from an exercise physiologist, somebody else may need more dietary advice. And so when I went through the paper from Heart Rhythm, I strongly believe that between all of these different programs that we offer, I believe our program does kind of hit all of those targets quite well, and I'm certainly happy to chat with anybody else out there. If you're building an atrial fibrillation center of excellence, you would like to talk to us about our experience, more than happy to share and help, all of us together help make our patients better.
I'm very impressed with how you're able to create such a comprehensive, multidisciplinary team, and you have this openness for modalities that aren't traditionally, considered medical, and I think it's incredible what you're doing for patients. If you could give somebody who is trying to be like you, somebody who's trying to build the best possible center for their patients and, really taking on this leadership position of doing this, what is one piece of advice you would give them?
I would say, something that's been driving me, ever since I can remember, is that really anything is possible. And I think that's most important. A lot of us end up working in healthcare settings that are very dogmatic. As both you and I know, healthcare is very by the book. And so when you try to do something new, the first thing you're told is, well, we've always done it this way, and you just can't do anything out of the box or anything different. And you get shunned, you get ostracized for even trying. The bottom line is, with enough effort, if you have the effort and the perseverance, anything is possible, it can be done, the system can change, and it has to change. Because for years we've been really looking at these patients as, I'm going to treat the left upper chamber, and you're going to treat, their plumbing, as you said, you're going to treat their coronaries, and those two have nothing to do with each other. And obviously they do, because a lot of the risk factors that lead to atrial fibrillation or coronary artery disease are the same risk factors. Just a little anecdote, if I may. Recently we're enrolling for an atrial fibrillation ablation study, and one of the criteria was patients had to have a BMI less than 40. And for 2 months, we could not find any paroxysmal AFib patients whose BMI was under 40. And clearly, that BMI is driving their atrial fibrillation, is driving their blood pressure, is driving their sleep apnea, is driving their coronary disease, is driving a number of other negative metrics. And by just fixing their coronary or ablating their atrial fibrillation, we're really not going after the underlying cause of all of this. So I strongly believe that this multidisciplinary approach is of paramount importance, and if you cannot build it easily in your institution, you have to look outside and ultimately make it happen. In our case, we do it through a private-public partnership, in a sense that all of these pre- and post-clinics are run completely outside of the hospital. We were able to build all of that through our private clinic infrastructure, while the procedures, triage, et cetera, all happen in the hospital. And it works very well. It works very well in combination and in this type of partnership. Obviously, everybody's situation is different, but the bottom line is, dream big and make it happen.
So many pieces of wisdom in this whole thing. I feel like I'm going to listen to this every morning on my way to work, because I feel like I needed that message today. And so you brought up a lot of really interesting points, even beyond clinical medicine. It's about, if it doesn't already exist, it doesn't mean it can exist. And so that's how great ideas become reality. So you're super inspiring. Grateful that you share that perspective. Also, unrelated, outside of the EP world, when you're not ablating, when you're not doing your EP stuff and building programs and creating centers of excellence, what do you do for fun?
I must say that unfortunately I do like working, and working is fun to a large extent, but I do like innovating. In the last couple of years, it's been really fun to work with these technology startups on new technologies, applications of artificial intelligence to diagnostics, to patient care, as we're doing with a voice AI system, etc. But for really fun, love to ski, love to travel, love to scuba dive, and so if you work somewhere close, if you work or live somewhere close to the hills, the beach, or elsewhere, I'm happy to come and share our experience